Who is our minutes taker from this committee? Okay, very good. All right, and then our chair can call it to order as soon as we get the live stream going, and Sarah will let us know.
Okay.
Okay, very good. You're welcome to call the meeting to order.
Hi, this is Pam Reese, and I call the meeting to order. Welcome everyone to our Experience Committee Subcommittee Task Force. And I'm going to let Catherine go ahead and do a roll call.
Sorry, I just got bounced out.
I'm sorry.
Back. Actually, all right. I don't have the list in front of me. I'm just going to go through. I've got Jennifer and Diane, Pakunka. I'm sorry. Would you pronounce your last name for me?
Pakunka.
Pakunka. All right.
Thank you.
And Beverly Laubert.
Hello.
And Doug Beach.
I'm here.
Lisa Broekman.
Here.
And Pam Reese.
Here.
And I believe that means we are missing
Senator Yuko.
Yeah.
Rhonda Johnson.
Yeah, and Rhonda.
And Melissa Schiffel was unable to attend, so I do know that.
All right.
All right. So I sent out an agenda and just some limited information that I'm hoping everyone received. And the first on our agenda is the task list. And what I did was I broke it down to our objectives, to our specific objectives for our committee. And then I highlighted what is expected of us in this committee. And I added the other committee, maybe it was capacity, suggested that we take on 3 more tasks. And I also included those. So when you go through the topics, what I did was I labeled them. We have 13 topics specific to us. And then at the end of each topic, I put where it was on the original Senate bill task list. And then I also included what other subcommittee is inclusive of these specific items. But in reading our expectations, there's a lot of information that we're going to have to obtain. We're going to have to understand our specific tasks, but then of course it says that, you know, part of our responsibility, as it is with the other subcommittees, is to share and to collaborate on information. And so I sent out some limited initial information that relates to the training requirements in Ohio. If any of you know anything different than me or what I found, please, you know, feel free. But I included the Ohio Legislative Service Commission, the information that relates to training in Ohio, and it's not incredibly specific in that it's not inclusive of the hours required. And so again, information we're going to have to receive. But it gives us a sense that yes, it is a mandate that right now today, everyone working with dementia and Alzheimer's has to go through some training and has to have that training documented. It's not specific as to which training that they have to have. However, CMS recommends the hand-over-hand training, and I just included that in the information sheet. And what I did was I just copied part of that CMS transmittal. And that is for skilled nursing and rehabilitation centers. And so I am today, I'm not sure if that's what the assisted livings are using. Now, I know some assisted livings, and Beverly, you might know this a lot more than I know a lot of facilities use different information for their training. So for instance, the Teepa Snow, if you've ever heard of her, is sort of the warrior of dementia and Alzheimer's training. I know a lot of assisted livings watch that today, but in saying all this, obviously we have a big task initially to obtain information, to give us our benchmarks, and then deciding where do we get that, and then who do we speak to. So we need some additional resources that to help us. Do you all agree with that?
Yes.
Yes. Okay. And so I guess let's start there. I'd like to know, just in your input too, what are some entities that we can reach out to get the state requirement information? We already know just from the readings, there's 700 and whatever assisted livings. There's, and I'm looking at my notes, 370 memory care homes, 30 board and care homes, which I'm not even real familiar with. And those house 12 or under numbers of residents with Alzheimer's or dementia. We have the average cost. And then on the one transmittal or the one information sheet I sent out, it lists what that cost is from high to the lowest, Dayton being the highest for memory care cost, and Cleveland being the lowest. And so this is just the initials of what we're looking for. And so one of our tasks in our next conversation should be about how do we obtain these resources, what to have our benchmarks and to make educated decisions to help us. So anyway.
I had a question about, you sent House Bill 732.
Yes.
What were your thoughts about that? Because that's not law.
So
That
forgive me,
bill
Beverly,
did not-
I'm not,
That bill
you know,
didn't
I
pass.
just, I'm obtaining the information. My thoughts about it was, this is just how it's delineating the requirement that Ohio is required.
But it actually didn't pass, so it's not.
Okay, see, so I don't know that.
Yeah, that was never
Okay.
passed.
So then my next, and that leads me to, then we need some accurate and what is in place today. I know for CMS, for the skilled nursing, but I don't know for the other.
Yeah, so we can just go look at the statute and the rules that are currently in place. Basically, Catherine, you'll know better than I will because you work with it every day probably, but Ohio law and rules are pretty vague. It just says that if a facility has a specialized unit, they have to provide training to staff to be able to meet the needs of people on that unit. So there really isn't anything other than what might be in the nurse aid curriculum that is specific to dementia in terms of a requirement.
So we already know
Hand
that.
in hand. Yeah, in nursing homes, hand in hand was provided to every nursing home many years ago, but it was up to the nursing home to decide whether to use it or not.
Absolutely, and I do know that. I know that different nursing homes will use different training modules. And so the requirement is today, and correct me if I'm wrong, it's to have some training, but there's no requirement on what specific training that is or how many hours. Am I correct?
Mm-hmm.
So Beverly, can I ask a clarification question as well? You very specifically said that nursing homes that have a specific section for dementia. So does that mean that nursing homes that don't have a specific memory care unit do not have any dementia training requirements?
Other than what's in the nurse aid curriculum, correct, Catherine?
I'm going to have to double check that, Bev.
I
Yeah.
would, just from my experience in skilled nursing, whether they have a memory care unit or not, they are required to have the dementia training. And I know when I had facilities, we had to give Alzheimer's dementia training, but there's no requirement for dementia certifications, that kind of thing. But I do know, and again, we'd have to research the number today, but I knew what it was, that at one time, about 60% of all residents living in skilled nursing or receiving skilled care have a comorbidity of dementia or Alzheimer's. So the majority of their residents they're taking care of are afflicted with Alzheimer's.
There is a dementia certification that one of our members has created with a local career center. And so they have a very specific certification program that is to be used throughout their long-term care area, not just in the SNF rehab area. So there are some specialized programs out there.
But not mandated?
No. I wanted to make sure that we were also having our discussion incorporate beyond an institutional setting.
That was going to be one of my next topics. Beyond the institutional setting, we have home care, home health, we have hospice care, there's respite care.
I would also suggest emergency room.
Yes, and then
urgent
the
care,
hospital settings.
first responders, yeah.
Yes.
And most of the adult day folks are doing dementia care.
Yes.
So we have a broad spectrum of entities that deal with this on a daily basis.
So Bev, who licensed this stuff? Is it mostly ODH that license it? Is there somebody at ODH that we could get a little tutorial from to run down the different types of care and the different requirements for that care?
Yeah, I think that would probably make sense.
We could learn everywhere that they've had a hand in providing education. I know the EMTs get some sort of training. Don't know where that training comes from. So while we can get a look at everything that ODH touches, I'm not sure it's going to be comprehensive, right?
Right.
But they should know how to make it comprehensive.
Yeah, they're regulated entities. And then group homes, we have a lot of residential facilities that are regulated by the Department of Mental Health and Addiction Services, and many of those have older adults, and some of them with dementia, and some of them call themselves assisted living. So we should probably look at that as well.
What did we do with Polana? Didn't it have
Well, that was the legislation that that was sent around. House Bill 732 was Dorothy Palanda's. There was the House Bill, I want to say it was at 470, that Representative Schuring, there was some work that was done. Bonnie Berman, the Department of Aging contracted with Bonnie Berman. She facilitated some sessions. There's probably there are probably training recommendations in there as well. That report was not released.
Well, Catherine and I were on that group with Polana, and she was thinking about having an Alzheimer's training requirement, that everybody that worked in long-term care needed to have that Alzheimer's training requirement. Mm-hmm. And I just didn't know if there was if anything ever came of it, and if there was any study language with respect to that bill.
Representative Ginter pulled together a work group, and boy, my timing, it's only been a couple years, right? But I'm now off on my timing, maybe, but I think he may have picked up on it, and he had a pretty extensive work group that was trying to get through some of the hurdles in that, and I believe that it just didn't move forward. The struggle with that language, as I recall it, was that it wasn't clear how to delineate between the way the language was written. It could apply to caregivers in the home, and while that would provide perhaps a level of certification for those in the home, which would be good, because it would make them more employable if they wanted to move outside the home at some point and become a caregiver. There was this interconnection that was problematic. And how do you recognize those who've already received the training within an institutional setting? And so it just got bogged down, I'm afraid.
And she also had a requirement that everybody had to get it with no way to pay for it, which I always thought was a little difficult. They crucified me the day I said that. So.
And that reminds me, we have the caregivers at home too. And, we have to look at resources for them as well. So how do we, what's our best?
That's going to be a little hard to regulate, though.
It is. But if we have the resources,
well, the ODA does a good job with resources as well. I don't know how many caregivers go to it though, so it's
probably not many. Probably not many. So how do we start by obtaining all this information, or do we need to?
I think we do.
I do too.
I think that you're not going to find many people in this space that's any more connected than Bev, and my hope is that she may be able to, Catherine as well, may be able to connect us with the right people out there, to have some folks come in and share things that they've written already, and then give us a little presentation, show we can go in the right way. I'm a little disappointed that there isn't a subject expert on each one of our committees. A Bev is as close as
I agree with that. Yeah.
But it'd be nice to have some person who does this work on a regular basis to help guide what we're going to do.
I agree.
Does anyone recall if we have another task force member or guest that might have that information that, just isn't on our experience committee, but is on one of the others?
Yeah, I don't have my list in front of me, but it's possible. I suppose we could also, I haven't been into the shared link yet. I don't know if
I didn't see any documents there yet.
Yeah, I didn't see anything either.
Yes. A lot of the recommended resources, there were a couple of individuals named, but a lot of it was some national level research and links to that.
I would be happy to go to the Alzheimer's Association and see if there's any recommendations that have been considered either at a national level or what I was thinking more specifically was perhaps from another state plan, and see if there's something that could at least point us in a direction of data to follow. They may not have our data, but things to look at.
And who at ODH should we be talking to? Who at licensure? Or
I'm not sure, but I'll do a little research to see who the right person would be. Do you know off the top of your head, Bev?
I would guess Rick Hoover.
Okay, I'll start there.
I think, yeah, I would. I mean, he has been the supervisor of the person who does nurse aid training, but I think he's done a variety of things. I think he'd probably be the first resource to ask.
And should our request, Jennifer and I request that the individual take a portion of our agenda at our next meeting? Is that what we should try for?
I think so.
Okay.
But I think you're going to want to work with Alex on that quest. And work it
That's a good
through Alex.
point.
Work it through Alex rather than do it yourself.
You mean to schedule it?
Well, with Alex, he can say why it's happening, and it's happening on behalf of the legislation and out there in the work group, rather than us just asking a person individually.
All right.
I can volunteer to do that as well if you'd like me to. I can reach out to ODH. Does that sound good?
That sounds great.
Okay.
Is there anything happening at Scripps or Ohio State or Akron with respect to Alzheimer's legislation and Alzheimer's treatment in facilities?
I don't really know that. I know they have their research centers, but I don't really know that.
I know Applebaum's doing a study on MyCare right now, and he's of course studied Passport since the late 80s, but I don't know whether it has any specificity with respect to dementia care.
Well, they do a variety of things. They do the biannual long-term care survey, and they would have data on the needs of residents of, they do the survey both with the nursing homes and residential care facilities. And they also have, I'm trying to think what they call it. Preference-based. They have a project where they're working with some long-term care facilities on like the preferences. What's the Pelly? Yeah, I can't think of what the, but yeah, so they have some experience there. But I mean, I said in our last meeting, there are a variety of universities that are doing research in dementia, but I don't know how many of those really focus on the experience of living with dementia that we're charged with addressing.
You know, that brings to mind that I think that Suzanne Kunkel presented. We had our planned task force, and she described OMA, Opening Minds Through Art, that Scripps has, and also a way by which staff could know, in just approaching a resident, what some of their triggers isn't the right word, but what some of their interests were. And there was a way, does anybody remember this? There was a way by which you would have information maybe on the resident's wheelchair or in their room that would reflect what their interests were, so that there would be an immediate way that you could engage with that individual. And that was a program that they were doing some research on. I think it was at the very early stages. So that might be worth checking in on, Doug.
Yeah, they have a regular newsletter called Pelican that they send out about that, and it usually addresses that project.
So my name's Lisa. Hi, everybody. I work at the Lois Alzheimer Center down in Cincinnati, and I think while there are a bunch of great practices available for caring for people living with Alzheimer's and related dementia, I think part of the biggest challenge for people who are caring for someone living with Alzheimer's and dementia is knowing where to find resources and knowing that they're getting accurate information. There's a lot of misinformation out there, right? That sort of all memory care is created equal. And I think you all know that maybe that isn't always the case. So I think even I know the bill that talked about training for nurse aides specifically, and having that sort of dementia specific training is always a great idea. The problem is that a lot of the care for people living with Alzheimer's and dementia doesn't happen inside of a certified or skilled nursing community. So I don't know if we're sort of putting the cart before the horse and figuring out how do we come up with a rundown of where people are living and sort of the steps that they go through, because we all know, and I haven't heard an updated stat in the last couple of years, but a lot of primary care physicians aren't telling families, even when they believe that someone has Alzheimer's or related dementia. And so, how do we get through those first steps of now you have this diagnosis? What could that look like? 9 times out of 10, it's not pleasantly forgetting people's names. There's a lot of other things that go along with it, and really preparing people for what that might look like, so that then they're not so overwhelmed when something, acute happens.
I can't agree with you more, Lisa. And when you're a caregiver at home, right, or your loved one is diagnosed or not diagnosed, people will go a year and watch subtle changes in condition, not knowing that this is Alzheimer's, but assuming that it's a forgetfulness, because people want to deny. You want to deny that your mom, your loved one, your husband has Alzheimer's. But there are these very subtle changes in condition that education probably does need to be given for.
So should we reach out to one of the universities where there is med school training to find out where training for docs occurs on this topic?
I think so.
I would be happy.
And I don't think they're getting. I don't think they're
Go ahead,
getting
Doug.
much. I don't think they're getting much training. My son's a 5th-year resident. I don't know that he's ever had aging training other than, what you do surgically or in that type of situation. Behavioral health doesn't seem to be a big issue in a lot of the med schools. It's probably not a bad idea to think about that, though.
Yeah.
Yeah, and I mean, we could go down a giant rabbit hole of why that's the case, right? Reimbursement for caring for those things is not readily available. I know UC includes it in part of their program, that physicians go through some small amount of Alzheimer's and dementia training, but.
So Lisa, I know your facility has a medical director.
Yes.
How advanced is your medical director in Alzheimer's and dementia? Or do you contract with a psychologist or a neurologist?
Yeah, so both. Our medical director, Dr. Vijaya Reddy, is a licensed geriatrician and has, extensive experience with this population. We also work with Dr. Salman Ahmad, who's a psychiatrist with the UC group as well, who specializes in this population. So there are great physicians out there who know a lot. There's just also a lot of other physicians.
No, but there's so many facilities that don't have what you have. There's a
Yes.
lot of facilities that do not have that higher awareness of Alzheimer's and dementia. And so unfortunately, those residents are taken care of in a very mainstream, average way, right? And that's something for us to think about. There are great ones, but then there's not such great ones.
There's a county, Lake County, I don't know if it's their whole hospital system, but they have been involved with Project Echo through the Alzheimer's Association. And one of the things that I believe that they have mandated is they are running many of their primary care physicians through Project Echo in a effort to increase the awareness and education of Alzheimer's and dementia. When they see patients coming in, it's to help with the process of early diagnosis and referrals to specialists as needed. And they're really have embraced this as a something that they feel is critical within their whole hospital structure. I would be willing to talk with through the Alzheimer's Association, somebody at Lake County Hospital, and see if they'd even be willing to talk with us about what they've noticed in their own care, their own staff, why they chose to do this and what they're choosing to do, because it seems like it's pretty robust.
Yeah. Perfect. Perfect. And I was also just, as you were talking, I was thinking of the veteran homes as well. So many veterans with Alzheimer's and dementia, so we have to consider them as well. So right now we have some information. Some of us are reaching out to others and perhaps even attending our next meeting, correct, to give us some additional information. The other thing that we need to talk about is narratives from caregivers, providers, people with Alzheimer's, early stage Alzheimer's, talking to caregivers and some of the staff. How do we propose we do that? Should we be talking, Tessie, you might be able to help us with this, but on one of the questionnaires, I think, that we all filled out, there was, or maybe in one of our bigger committee meetings, we talked about having forums, a public forum, and inviting, maybe one is for caregivers in an institutional setting. Maybe one would be for inviting caregivers at home. And then maybe one is inviting, I don't know, maybe we want to invite doctors or maybe nurse practitioners. And then there's the folks with Alzheimer's. And so I feel like there's several categories in obtaining narratives and obtaining the up close information from these caregivers and people afflicted with the disease. Tessie, how do we go about doing that?
I think it would be establishing dates and times, right? We would have to think of the appropriate window that we want. Is this maybe a 2-hour event for each group? And then we could post the dates. And then I think it would be really up to our task force members to share those out. Of course, we can do public postings, et cetera. But we would have individuals register if they wanted to speak ahead of time. And so we could take that through, we could build like a web form where they can submit their name, a couple of the key messages they wish to share, contact information, and then we could schedule kind of a lineup for those public forum meetings where, if this were non-COVID time, we could certainly just say, show up at this place at this time.
It would be so meaningful, right?
Right. But I think we do need to schedule ahead just because we're going to do it virtually to make sure those individuals get the right links. Also to maybe manage our time a little bit more.
Yeah.
And I think the experience committee would be ideal for setting up those times for the whole task force to hear. I know we did talk about the public forums, but what were the 4 categories again? So caregivers, home.
There's the providers, right?
Okay.
The providers of memory care, assisted living, skilled nursing. Then there's the nurse aides, the staff, the caregivers that work in those institutions. There's the caregivers at home, and then there's the people that have early onset Alzheimer's that are able to communicate with us their needs. And then, as we look at these other entities like home health and hospice and emergency rooms, how do we obtain, what category does those groups, the EMTs, the first responders, would they fit into?
Almost unexpected caregivers, right? So they get engaged in ways where you wouldn't necessarily.
Unexpected caregivers, I like it.
Okay.
And that includes the police force too. I have heard horror stories of, from others whose family members are living with the disease, and a person may wander. They don't know where their home is. They get picked up by a police officer because they're considered, suspect in a neighborhood. They're just lost. How does that police officer approach them? So that category of first responders is really pretty broad.
I think it is.
Okay.
And think about how many Amber Alerts there are for an adult missing, right? Or driving and has no idea where they are.
Mm-hmm.
I would be happy, Tessie, to work with you on that.
Okay, that
Setting
sounds
those
great.
up.
Sure.
And I'd be happy to facilitate that through the Alzheimer's Association as well, because they have a very large network and can broadcast that.
Great. Great.
Okay. And so
there is current legislation about requiring first responders to have dementia training.
Yes.
didn't know that.
I don't know where that is in the process. Do you, Bev?
It was reported out of the Commerce and Labor Committee on March 23rd. So I think, as far as I know, it hasn't been passed by the House yet, but we can check. So that would be up for a vote on the House floor next, and then go to the Senate after that.
Does it indicate who would make that training?
Let me check real quick.
Because what I'm hearing is there are a lot of outstanding resources available already. So it's not as though we have to develop, but it's more the connecting the people that need the information with the resources.
Yes.
And, I've already heard so many audiences that you've identified just in, the first hour that we've been together. And so I'm wondering if, we keep working on this committee about that connection piece of it, right? That experience, so that when somebody does go through the process, they know where to go. So, what if we are coming up with a centralized training, and then we can modify it for law enforcement? And then if it becomes legislation, there it is, it's already in existence. Or we can modify it for those caregivers. And maybe, Alzheimer's Association is a great place, but many people probably don't go there. Unfortunately, Google doesn't always land you there, right? So maybe exploring different channels of how to get people to the right resources.
Looks like they would have basic training programs at approved peace officer training schools. And it's not very much. It's only, the Attorney General would write rules about the amount, but it has to be at least 2 hours of instruction, at least 1 hour on a variety. It has a list of topics, but it's not a lot, but it's something.
Okay. Perfect.
I'll put the link to the legislation in the chat.
Thank you.
Beverly, what was the number of that legislation?
Let me go back
bill,
and look
right?
real quick. It's amended House Bill 23.
23.
Mm-hmm.
Okay.
So right now in this meeting, we're talking about how to obtain our information, our connections, setting up some schedules to meet with the public, whatever group that they fall into. And then we're going to work on getting, to see if we can get a couple attendees at our next meeting to offer up information. Is that our goal?
To go back to Tessie's point about what might already be out there, when we were on the Polanda task force, Doug I just pulled out my notebook when this meeting started, and there was a report by the Jewish Federation of Cleveland, a pretty remarkable and comprehensive Alzheimer's and Dementia Task Force report. And so that brings up the faith-based community. And, you know, I just wonder if maybe going back through some of the work of that task force so that we're not recreating the wheel.
Yeah.
And,
I'm sure this information is out there in many forums.
yeah.
But I agree with you, Catherine. It's nice that it's in one location, and it was associated with a bill that was supposed to be going through the State House. And maybe there are things that we can learn from any of those. Am I echoing, or is it just okay? I'm
No,
hearing.
you're echoing.
Oh, you sound fine.
I'm hearing echoes in on my machine. Maybe
Yeah,
that
I
would
hear echoes.
maybe that would be a good approach. See if we can run down that that Jewish Federation report.
And who can do that? Oh, I don't hear any of you.
Sorry, I have a copy of it in my hand.
Oh, well, you already know. Okay.
So I will work to get more copies for everybody.
Thank you.
You know, back in previous jobs, one of the first people I would talk to is somebody like Applebaum to see if he can point us in a direction. I don't mind talking to him if y'all want me to.
That'd be great.
Although it sounds like Susie Kunkel may be the one that's more involved, but they're both at Scripps.
So from this meeting, should we communicate through the shared link or through email for our test meeting? How would you propose that we do that if we want to share information that prepares us for our next meeting?
Well, I will tell you that I am inhibited with computers, so I will have a better job giving Tessie a call and letting her tell me what to do.
Tessie, can we just send it all to you?
That's fine. Yeah, if you want to communicate through email, and then we can kind of drop it in that shared folder if we need to go back and reference it, because I don't know about you, but my emails come fast and furious and it drops down and gets buried quite quickly. So that way we know that it's there, but we can go back to the folder to reference. Does that sound like a good plan?
Yes.
Good.
And Tessie, just a question about protocol and operations. I did put our meeting summary on the shared drive. Is there any sort of approval process that's needed of those committee minutes, or what's the protocol?
Yes. So has everyone had an opportunity to review those? Okay. In that case, we can call for a motion to approve the minutes from the first committee meeting from Doug Beach, and a second by
Second.
Jennifer. Very good.
Yeah.
And all in favor of approving those minutes?
Aye.
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 Very good. Okay, so we have approved minutes and we'll get those posted. We'll do the same thing during the next meeting about the notes and minutes that come out of this meeting.
All right, and I'll put that in the meeting summary that they were approved.
Perfect.
Thank you.
But do you want me not to post them until we go through this process?
Please do it in the shared folder. That's perfectly fine. We're just looking for those approved minutes to post to the public website.
All right, got it.
Tessie, as we are talking with individuals, you know, those of us who have committed to doing that, as long as it is one other person, we don't have to make anything public. Is that correct?
That's correct. Yeah.
Okay.
That's not a problem. Now, just remember your emails and other such records are public record. But yeah, we don't have to have a meeting broadcast if you're just having a conversation, just one-on-one.
Okay.
One of the tasks is about the legal aspects. And I'm thinking Melissa, who is a defense attorney, who is very involved with this, would be a fabulous person to take that on, and I'm sure she wouldn't mind. I just wanted to bring that up.
Mhm.
Do we feel comfortable in what we're doing for our task and for our information over the next couple weeks? I know we're not really there yet. We're still in the gathering and collecting phase, and then we'll come to the analysis phase, right, of deciphering it all and seeing where we go from there. But are we comfortable in where we are today?
Well, I am a little confused
Okay.
because this is the second task force I've been on, but and Catherine, help me out here. It seemed to me when we did the Palanda thing, we had staff support to help us write this stuff up and push it forward. Did we not?
Yeah, we did. The members were not doing that work. It was all done by the staff.
And I don't know if we have staff support here. Tessie, do we have staff support?
We will. So Julie Trackler talked last time about that request for proposal for a contractor to work with the task force. And so that contractor will really be the one kind of synthesizing all the recommendations, pulling it together into a report form.
That would be
great. You all will have the input, you will have the review, but they will be the compilers and the organizers.
And when do we expect that to happen?
I think the contract is getting close to being released. I can check in with Julie and see how soon that is. But we hope to have them on contract within the next couple of weeks here.
So does that mean that they would begin joining our calls?
I hope so. Yes.
So the RFP was posted?
I don't know that it was posted. I think that she was finalizing it to get it posted.
Okay. Yeah, I think she said, Doug, about 30 days was her hope.
Okay, thank you.
And I know that there's been mention about asking for an extension of when that report does need to be filed, just because it took a little while to get everybody appointed to the task force, and we want to make sure that we have fair input from everybody.
I agree. I feel I'm a little fragmented right now just in the collection. And so I feel like we need a little time to get ourselves on that right track of.
Absolutely. Well, and it's been a strange year, so we will. I'm sure everybody will be fine with that because they want the report to be very thorough and thoughtful. Sure. So we will be asking for that, I believe.
Okay.
Pam, going back to your question about, do we understand what we've talked about and committed to so far? And I, in my mind, I think yes. The answer is clearly for the things that we've defined so far, it's pretty well outlined. My question would be there, we have 13 of these tasks associated to our group, and it seems to me that there is much more data, different kinds of data required for the entirety of that list. Is it your plan to just bite off a few of these initially, or should we be looking at, between now and the next meeting, if any of us have any ideas of resources or data that we think would be informative?
That's a great question. And yes, I think that as a group, we should all be looking at those to see what is applicable, what can we individually do. I can also break it down a little more into we need and make it kind of a bullet point to just keep us organized.
I think what we should do is go back and review all of them, give all but the 3 most pertinent ones to everybody else, and then we can do the 3 we want to do.
And have them collaborate their information with them.
Isn't that what they did to us? They just gave them away.
So I will absolutely go through them and delineate out, we need, it's going to be simple, this, and then we can kind of break it up. Does that make sense? Okay.
Sure.
Is there anything else? Lisa, you okay? Diane?
Yeah, sounds good.
Diane?
Yeah, I'm all right.
Okay.
One thing that would be interesting though is to reach out to the Alzheimer's Association and see if we can bring in somebody from the Alzheimer's Association to just kind of give us a 30,000 feet overview of what's going on with respect to Alzheimer's in Ohio.
Well, they are on the task force, and I just want to be careful that we're talking about all types of dementia and not only Alzheimer's.
That's correct.
Yeah. So to that point, Trey is on, I think, the Science Committee. He's actually the legislative liaison for the Alzheimer's Association here in Ohio. But there are other individuals that work across Ohio, and one of them that comes to mind is, her name is going to escape me now, of course, but she works with the hospital systems and, trying to get resources out there to coordinate amongst the skilled and professional providers. That might be somebody that can come talk to us about what's happening in Ohio. If we want to do that, I'd be happy to request that while I'm talking with Vince.
Okay.
That sounds like a great idea to help level set and at least to give a broad overall perspective.
And then when it's all said and done, we might end up with too much information, but I think that's okay, because then once you have too much, you can start getting to what you really need.
Well, we're going to have trouble though focusing on just the experience side.
Experience is big because it's taking in so many variables. And so you're right. We're going to have to reach our point where we decide what are the bigger issues? What are the priorities? I agree with that. All right.
Okay, so the next meeting's in 2 weeks, correct?
Correct.
Okay, and I'll send out a corrected and updated meeting invitation. I'll do the invitation as well as putting the link in an email to everybody just to make sure we don't get caught in any filters.
Okay.
All right, and you're welcome. Yes, ma'am. Oh, Catherine, check your microphone. There you go.
Sorry, did we agree that we are going to be asking somebody from like Trey to come and speak to us as well as the individual from the health system? Is that right? Or do we back away from Alzheimer's Association? I'm just trying to get my notes straight.
I thought I was talking to somebody to bring someone in from the association. It could be Trey. It could be somebody from the medical, the medical liaison, health liaison, I think is the title.
Okay.
I'll also look to find, I don't think that the National Alzheimer's Association has put together their statistics yet for this year, but certainly I can get last year's report to give us some direction of what's going on nationally. And we also put together, I shouldn't say we, I'm a user of the association, not an employee, but they also put together a document for the state of Ohio regarding the number of people living with dementia, resources, et cetera. I'll see if that's available for this year, or I'll get last year's update.
This last year with people not able to keep regular appointments and non-essential visits, think of how many people there are with the diagnosis that haven't even been diagnosed yet, haven't even made it to their providers.
I do have the report on Ohio from the Alzheimer's Association, but it's 2017 data. I'm sure
it's updated. Yeah.
Thanks. I just wanted to make sure I understood that last piece of conversation, Tessie. Sorry to interrupt.
Is there anything else? Okay, then I call to adjourn.
Okay.
Is that right, Tessie? Am I doing?
You are, yes. If you want to be very formal, you can ask for a motion to adjourn.
Oh, and I have an emotion To adjourn.
So
Thank
moved.
you.
Second it.
And a second. Very good.
Don't
And
have to
everybody in
teach
favor?
me how to do this.
It was my life for years.
Okay.
Well, I don't know that you have to have a vote because it's non-amendable and non-debatable.
Oh, see, I don't know. You all have to keep me on track here.
We're
Way
good.
to go
We're
with the
good.
Robert rules understanding. That's great.
All
All
right,
right.
everyone. Thank you. We'll talk in 2 weeks.
All right. Bye-bye.
Sounds good. All right, bye-bye.
Thanks. Bye-bye.
Bye-bye.